Hey everybody, it's Melanie, the Carnivore Queen. I wanted to do a really quick update video on my interstitial cystitis. So I used to have interstitial cystitis. I've had it my entire life. I was not formally diagnosed with it until I was 22 years old. Um, and now I don't have it anymore. I changed my diet about 3.5 years ago. February of 2021, I went carnivore and I have experienced tremendous healing. It's the most amazing thing I've ever done for myself. I did it because I had heard about it helping with joint pain. Wasn't even the intention to, you know, lose weight or anything like that. And lo and behold, I lost 70 pounds. And in the meantime, I cured my interstitial cystitis. So I no longer have these painful, days, spent in the bathroom, incomplete emptying of the bladder. I used to have spasms. I used to have what felt like knives being stuck up my pelvis. I used to have just terrible shooting pains going through me. And I would, go to the bathroom and there would be blood in my urine. I was misdiagnosed my entire life. No one caught on that I had a chronic, disease. And I don't have to go to the urologist anymore. I don't have to be on pills anymore. The medication that I was taking for years was actually, it's under a class action lawsuit right now because it's like causing people to go blind, among other things. Well, that's great. So I don't take that anymore. I simply changed the way I ate. I know I say simply, it's not simple. Changing your diet and your lifestyle is like the hardest thing on the planet, in my opinion. So what do I eat now? I eat a carnivore diet. I eat meat, mostly beef, especially grass-fed if I can get it. So beef, eggs. I eat a ton of eggs, mostly the yolk. I eat a stick of butter, real butter, every day. And the reason it's a stick is because I'm cooking all of these things in the butter plus putting it on top. I know, crazy, right? So what did I say? Oh yeah, beef, eggs, butter, shrimp. I eat a lot of shrimp. I don't get sick of it. I don't know why. Sometimes I will. I take that back. Chicken is a very rare thing that I will eat. I got super burnt out of chicken like a year ago, and so now I'm just like, that just sounds awful to me. So yeah, that's what I eat. I also drink coffee every day, and I put coconut cream in it. No, coconut cream and coffee are not carnivore, but that's what I do. I'm just telling you what's worked for me. Most people would tell you if you have any sort of bladder or, any sort of bladder issue to avoid coffee. And that might be true for you. So just because this diet works for me, um, it might not be exactly what you need, but it could definitely be something to look into if you have painful bladder syndrome, interstitial cystitis. That's, it kind of goes hand in hand that it's called that. I call it chronic UTI. People that have chronic UTIs, that's what everybody thought I had, and I actually didn't have any bacteria in my urine, but I always had blood in the urine because I had Hunter's ulcers, and those are like pinpoint, like broken blood vessels, so pinpoint bleeding in the bladder. I went through years and years of pain, and to think that all of that was actually my own doing by what I was eating is beyond, I don't know. I don't even know how to like handle that or process that. Yeah, and if I tell people now, you know, all the things that I've fixed by eating mostly meat and eggs and butter, they look at me like, what? You know, and yeah, it does. It sounds crazy. It's the complete opposite of everything anyone has ever told me to eat. I mean, I can remember going and watching movies on nutrition. When I was a little girl, we would go to the counselor's office and watch these videos, and it would talk about, you know, you needed whatever 10 servings of vegetables and fruits, and you needed 10 servings of grains and whatever it all was. And what did that get me? You know, I got sick. I had problems. I had all kinds of problems. I ate nothing but carbohydrates for years and years and years and years. I don't know how I'm not dead. I really don't. And this is the other weird thing. Every time I would go to the doctor and I had any blood work done, I've always had like normal results on just about anything. I've even had, I've had like endoscopies, colonoscopies, things like that because of how bad my stomach was. I had terrible stomach problems for years and years and years. And that is a side effect of taking too many antibiotics. Yeah. Well, guess why I was taking antibiotics? Because they thought I had UTIs, and I really didn't have any bacteria in the urine. And when you throw an antibiotic into somebody that doesn't even need it, I mean, you're just asking for trouble. So that was me. But yeah, changing my diet to a carnivore diet eliminated my interstitial cystitis. And I feel like I need to tell people this, and I want to share it with others that there is hope, there is healing, and it's the last thing you would think. It's what you're putting in your mouth. It's your fork. It's, you know, it's the food that we have been eating that's really causing a lot of these crazy diseases and problems. And that's a hard pill to swallow because it's a self-induced thing. It's my own doing. Obviously, I didn't have any control over the foods I was given as a child. But my parents, they had no idea. They didn't know. You know, I grew up in the 80s, and we didn't have access to the things we do now with all this information. So yeah, I can't dwell on that. I can just talk about how I have come through that pain, very painful past, you know, of being misdiagnosed and having chronic bladder problems. I used to have notes written when I was in school because I had to go to the bathroom so much. My mom had to write a note saying, please allow her to use the bathroom, because they thought I was just trying to get out of class, and they didn't know I was having, they call it like, well, it's like a voiding issue or emptying of the bladder. I would pee and it would just be like little squirts, like just. So that was part of the interstitial cystitis, causing the spasms and things like that. So if you have interstitial cystitis, I want to know if you have ever considered your diet and taken a hard look at what you've been eating, and have you considered that it could be your food? Because I'm here to tell you that's what cured me, is switching my diet completely to carnivore. And it's very difficult, but you can do it, and it's worth it, because I could not go another day in pain like I was. And you know what I'm talking about. So I will see you in the next video, and I hope this helped you. And if it did help you in some way, I would love it if you could share it, or subscribe, or like it, or comment. yeah, so that I can continue making videos like this.